Okay lah, alright. I'm very busy tonight, so we're not going to wait anymore. Oh, can we record this? Huh? Okay, fine. It's okay. Okay, let's begin our session with Ummul Kitab Al-Fatihah. Okay. All right. Let me share the screen. Okay, can you see my slide?
Yes, doctor.
Yes, doctor.
Okay. All right. So the topic that we're going to discuss about tonight is communication in pediatrics. Betul kan? Kita salah topik.
Yes.
Fine. Okay. So this is a new topic in in our pediatric teaching. I think we started to put this inside our list of lectures. I think probably beginning of May or something. I think out of those your seniors that have just graduated last week, I think only 2 of the groups got to receive this lecture. Why we included this? Few things. First, I think okay, you guys are using the old curriculum. For the 3rd years, the 4th years, they are using the new curriculum. So in the new curriculum, one of the exam component is actually communication station, part of their man or ski, and this man or ski has higher weightage even as compared to long case. So communication station, from my assessment, our students struggle in communication station, struggle badly. And then I think the other issue is most of the, if you look at most medical legal issues, most medical legal cases, mostly the problem is actually not because of poor management, not because of knowledge issue, mostly it's because of communication breakdown, mostly because of communication breakdown. So that is why if you see bogus doctors, sometimes they don't have proper knowledge, they practice weird type of medicine, they are not evidence based, but no one sues them. Why no one sues them? Because they have very good communication. Sometimes we, those who properly diligently follow evidence, sometimes we have very good knowledge, we have very good clinical skills, we have very good clinical acumen, very excellent clinical judgment, but we have very poor communication skill, we have very poor soft skill, we have very poor human skills, and these are our shortcomings. That is why people refuse to follow our advice. Our patients refuse to follow our advice. Our patients sue us, medical legal cases, all this because of poor communication skill, and this actually reflects in your exam. Many students sometimes, when you don't communicate well, you won't get the proper history, the proper information from the patient. You won't get the patient to be cooperative with you. Yeah. So there's a lot of problems. So I've handled student exam in UIA, of course. I've seen student in USM, in MMU. I've handled student exam when I was in UK. So King's College Hospital, and also King's College University, King's College London, KCL. So I've handled their student exam. There are few Malaysian medical students there as well. So I was part of the examiner for the exam. The thing is, what I can say is, in terms of knowledge, our students, you guys from IIUM, in terms of knowledge, you guys are around the same. knowledge, we are at par. In clinical skills, I can say clinical skills, you guys are a bit better than people, students from UK, for example. IIM students generally, in terms of clinical skill, we are among the best among the graduate. This is fact. But the problem is communication. You have the knowledge, you have the information, you have the skills, but you don't know how to portray, you don't know how to verbalize, you don't know how to vomit out all those brilliant information inside your brain. So this is the problem. We don't have good command of English, despite this university being a international university. That's the only university in Malaysia that's using 100% English as our lingua franca. But our command of English is poor. And then we don't know how to verbalize things. We don't know how to organize our thoughts. We don't know how to organize our speech. So this is the problem. This is the problem. And this actually affects us. I can give you one example. One simple orang kampung punya example. You know, semua suka makan nasi lemak kan? Nasi lemak ni, this is if you you'll have classes with me, you memang nak muntah dengar this example from me. I'm going to repeat this same example many times. Kan? Orang Malaysia kita semua suka makan nasi lemak. Tak suka makan nasi lemak pergi UK ke mana makan salmon kan. Fine. So kita semua suka makan nasi lemak. Okay, can you imagine if you have satu makcik ni, you know her nasi lemak is the best nasi lemak in the world. Tak ada dah orang lain masak nasi lemak yang best macam makcik ni. Makcik ni yang paling power masak nasi lemak. By evidence based, by experience, your own experience, you know makcik ni punya nasi lemak is the best nasi lemak. By randomized control trial, you dah ambil dah orang kampung try randomize semua, memang semua kata betul, proven. P value less than 0.05. Nasi lemak ni memang the best nasi lemak in the world. Tapi makcik ni nasi dengan sambal dengan telur semua dia main campak je, letak plastik, letak sok khabar tu, campak goncang, balut ikat tepi macam tu. Do you think you're gonna buy? Even though it's evidence based, it's proven, you have experienced it, you know by fact sedap. Tapi kalau presentation dia buruk, dia letak kedai dia tepi tong sampah, for example, are you going to buy? Even though you know it's clean, tapi sebab dekat dengan tong sampah, you're not going to buy because how they present tu teruk. Faham tak? Pernah makan nasi lemak dekat hotel? Ada tak siapa-siapa dalam dunia ni yang kata nasi lemak dekat hotel ni sedap? No one ever kata nasi lemak dekat hotel ni sedap. Is by experience, evidence based, randomized control trial. Semua orang tahu, kan? Semua orang tahu nasi lemak dekat hotel memang tak best, kan? Memang tak best. Semua orang tahu, by fact semua orang tahu, kan? Tapi bila kita pergi buffet, kan? Sekarang tak boleh buffet dah hotel lah kan? Sama-sama sebelum PKP dulu kan? Bila kita nampak nasi lemak di hotel tu, kita rasa macam nak makan tak? We are tempted to eat that. Kenapa kita tempted nak eat nasi lemak di hotel tu? Walaupun kita tahu, our brain tahu dah, memang tak best. Tapi sebab presentation dia tu gempak kan? Nasi lemak dia nampak shiny, ada asap-asap keluar, ada steam dia, sambal dia pun nampak sedap. Walaupun kita tahu, we know by fact memang tak sedap, kan? Tapi dia buat macam tu, telur pun macam tu kan. Kita pun macam, apa? Kan? Kita akan try. Walaupun kita tahu, memang tak sedap. Bila kita rasa, oh betul memang tak sedap kan. Tapi kita still rasa nak ambil. Sebab apa? Sebab presentation dia menarik. So sama juga dengan kita. Sama juga dengan you all bila you present. Kan? Sometimes bila you present poorly, very bad English, bahasa berceramuk, gabra, you punya presentation pun tak okay, tak ada eye contact, berpeluh-peluh dan sebagainya. Walaupun your presentation tu is full with all the adequate information, full with knowledge, tapi if you do not present it properly, kan, even minor error, even small mistake, people akan notice and jadi besar. Even if it's not wrong, even if it's disorder, pun orang akan nampak wrong. Tapi if you present it properly with very good command of English, you organize it properly, yang atas patutnya di atas, yang di bawah sepatutnya di bawah. Even major error sometimes people can ignore. So this is why presentation is very important. How you present things, how you present yourself is extremely important. Bukan sebab apa, tapi sebab those yang we are communicating with are human. And this is how human behave. Human is very predictable. Human is actually very predictable. The more they say, the more they claim they are unpredictable, the more they are actually predictable. It is predicted that human will say they are unpredictable. So that is why presenting well is extremely important. Presenting well is extremely important. How you present yourself. Yeah? Okay, alright, dah sampai mengarut dah ni. Fine. So, the first thing, children are not small human. Children are not small human. They are not miniature human being. They are not just children. They are not mere homunculus. They are not small human. They are by themselves. They have their own capabilities. And at different age, they are different at different ages. Even bacteria that affect them, even microorganisms that affect them differs according to their age. Newborns, for example, are exposed to different types of bugs. Toddlers affected by different types of bugs, different types of diseases. And school-going children are affected by different bugs and different diseases. So even bugs pun tahu they are different. So that is why we need to acknowledge they are different according to their age, according by their gender, because they are not just miniature human being. They are not just homunculus. They are different by themselves. So they have different cognitive development at different stages. They have different cognitive capabilities. And this is according to their different stages. So how we communicate with them, how you expect them to communicate with you as well, will differ according to their different cognitive capabilities and different cognitive development. But one thing we need to remember, we acknowledge their different cognitive development, but that does not mean we need to speak at their level of cognitive development. We acknowledge, we go around it, and we need to figure out how we can communicate with their cognitive development. One thing, for example, newborn babies, what is their capabilities first in terms of communication, in terms of language? Let's start with cooing. After cooing ni apa? Cooing ni bunyi macam wah, baby talks kan. Lepas tu dia start to babble, ba ma kan. Kan, lepas babble dia akan cakap by 12 months old dia akan cakap with single word sentence. Single word sentence usually is monosyllable. Lepas tu after 18 months baru dia akan ada polysyllable word. Polysyllable. Monosyllable macam kereta jadi ter, kan? Polysyllable jadi kereta, tu polysyllable. Kan? Usually by 1 year old single word sentence. Air, susu, kan, dia single word sentence, satu word dia cakap in words, kan. Lepas tu by 2 years old baru dia akan cakap in 2 word sentence, nak air, nak susu. Sometimes certain words may still be monosyllable, but more polysyllable dah start ada. By 3 years old baru dia akan cakap in a proper sentence, because proper sentence minimum 3 words. Very few sentence you can do with just 2 words. I do. Semua kebanyakannya is at least 3 words, kan? Proper sentence kena ada 3 words. So 3 word sentence is the by 3 years and above. But that does not mean below 3 years old we need to speak with them with 2 word sentences. No, that does not mean Baby, when we speak, when we communicate with them, we communicate in cooing, in baby talks. No, you speak to babies, actually you should use proper language. Because why? When you speak proper language to babies, actually it gets into their subconscious mind. It helps them to actually master language much faster. If you speak in baby words, baby will not be exposed to proper language. It will delay in terms of their language, their language development. And by different ages as well, they have different motor and speech development, the capabilities. So you need to acknowledge them, how you communicate with them, because communication is not just verbal. Communication involves action. Communication involves motor action, and so on and so forth. It involves the upbringing as well. For example, Asian families, we are more introvert. We do not encourage yet our children to actually speak up. Cakap lebih sikit, tak boleh, depan orang tu kan cakap senyap dan sebagainya. Sebab tu sampai depan cikgu pun ya kan tak boleh lawan cikgu semua kan. Ada masalah lah kan. But when I was in UK, medical student dia, even the biggest professor, vice president of RCPCH, even when I was very young dulu, I used to read her paper kan. She's the basics of most of our resuscitation protocol follows her paper, her hallmark paper kan. Even big professor macam Prof N Greenaf, nama dia is very huge name in neonatal ni. Medical students selamba tak agree pun cakap tak agree. I don't dan selamba boleh still argue kan. Kita betul nak argue kan. Itu tak ada. So our upbringing is like that. Well, it's good in some way, but the problem is sometimes kita susah nak expose, kita susah nak verbalize our opinion. So sometimes upbringing as well will affect how we communicate, and also parental expectation. Okay, again, this one I mentioned before. Newborns are still to be communicated with. You need to communicate with newborns. Can I'm a neonatologist. My subspecialty is newborn intensive care. So I handle newborns. The thing is, when you handle newborns, you need to speak with them. Tak boleh kita nak cucuk baby, kita just lamba ambil tangan zerak cucuk. No, we need to communicate with them. Adik, baby, kita nak cucuk sikit ni, and you communicate with them. Of course, you don't expect for them to reply. Tak apalah doktor buat. No, tak ada. Of course, you don't expect them to reply lah kan. Kalau dia reply tu salah juga kan. So aku benda lain reply. So you don't expect them to reply lah. But the thing is, they acknowledge. You know, children, the first sense, the ear, yang first they get is actually hearing. Even in utero, the first sense that they get, the first sensory develop is actually hearing. Even in Quran, Allah mention inna sam'a wal basar. Sam'a yang first kita get. So they can understand. They can understand your tone of voice. Children, they don't understand anger, but they can understand from your tone of voice. They understand that this is anger. This is not good. This is good. They can understand in terms of your tone of voice. So you need to communicate with them even if they are newborns. They sense parental voice exposed accidentally. So they know this is the voice of my father. This is the voice of my mother. Kan? Kalau mak ayah selalu argue, that is what gets into their subconscious mind. If parents selalu mengaji, baca Quran, even masa antenatal, so this gets into their subconscious mind. If parents used to read books, for example, kan, in Western countries, even in Korea, Korea is among the most advanced sekarang in terms of Asian ni. Genetic study in the world sekarang ni, Korea is among the top sekarang ni. They are more advanced than Western countries. Korea, Japan, neonatal, Japan now, they can even 22-week baby can survive in Japan. So they are very advanced. In this sort of countries, advanced countries, what they do is, even in newborn period, they read books to them. They read books to not just to baby, they read books to fetus. And because you know, this can help the fetus to grow. Studies have shown if you read books to babies, newborn babies, if you read books to newborn babies, they have better literacy rate. They have they master language faster if they are read to. Kan? In Malaysia, how many parents read books to their children? I'm not talking about newborn babies. I'm talking about children. How many parents read book to children? Kan? I'm trying to get our parents here in our NSU to read books to them. No one did yet. And when I was in UK, every day I see parents by the incubator reading books to their babies. Yeah, so this is a problem. This is a problem because the more you read books to newborn babies, the faster they get command of language. They have better literacy rate. Sekarang ni darjah 1 berapa ramai yang reading pun tak boleh baca lagi. Tambah pula dengan PKP, dah masuk darjah 2 dah. Yesterday I was involved in the PIBG meeting in my son's school. Kan, teacher pun complain. Quite a number of their year 1 student baca pun tak pandai. Kan? Nak masuk darjah 2. Kan? Baca pun tak pandai. Macam mana? Kan? PKP. Nak buat online learning macam mana? Kan? Darjah 4, darjah 5, darjah 6 pun dia lah buat online learning sebab dia pandai baca. Darjah 1 nak online learning macam mana kalau parents semua work? Kan? Nak baca mana satu Zoom punya link account pun tak erti. Macam mana? Kan? So that's difficult. Kan? So that is why reading to children is actually very important. And I must say juga, you all semua akan jadi parents nanti. One good thing yang Westerner buat, actually dia bedtime stories tu, it's very good. Sebab apa? Before you go to sleep, is the time when your brain is actually at tranquil. Kita punya brain, kan, bila kita tengah kelam kabut, it's very difficult for us to absorb information. Tapi when we are tranquil, it's very easy for the information to get absorbed into our brain and dia akan go directly into your subconscious mind. So that is where you want to put all those things. And so before going to sleep, it's actually the best time untuk get information directly into the subconscious mind. Sebab itu bedtime stories should be stories that have moral punya issues, kan? Orang putih dia punya bedtime story dia kadang kita mengarut juga, kan? So tapi itulah maknanya sepatutnya those are the time yang kita guna untuk teach our children bedtime stories. Read to them rhythmic sounds. Studies have shown children who are exposed to certain rhythmic sounds, they improve better in NICU. Ventilated babies, they are extubated faster. For example, dia pasang Beethoven, classical music, kan? So they improve faster. Quran, for example, kan? Sebab itu in our unit memang always ada background music Quran. So newborn babies, even though they don't understand, but when exposed to this rhythmic sound, it actually helps. I think probably even azan, kan? Sebab itu kita azan awal, it helps actually. Hearing these rhythmic sounds actually help calm our babies. So when you have a session, communication session is not just specific. Hari ini saya nak berkomunicate dengan you. No, it's not just that. So every interaction we have with our patient, with the parents of our patient, all are communication sessions. When you want to get history, for example, that's a communication scenario. When you want to update or you want to counsel parents about results of investigation, those are communication scenarios. When you want to get history, even you've got history, now you want to come for short case, physical examination, that is communication as well, even though mostly it's non-verbal. So all this communication is actually hablum minan nas. How you communicate, how you link with other human beings. So a communication session, it should be planned. So it should not be ad hoc. Yes, sometimes the request may be ad hoc, but even though ad hoc, you still need to plan what's going to happen. So the session must have clear objective. You tak boleh nak jumpa ada parents, okay mak ini nak jumpa ni. Tapi untuk apa jumpa ni kita pun tak tahu lagi. Tapi yang pasti nak kena jumpa sebab dalam jadual nak kena ada isi. Tak boleh macam tu. You tak boleh main kalau ada apa nak buat. No, tak ada. You must have a clear objective. What do you want to achieve? You want to get clear history, or you want to get more information, or you want to relay information. You want to tell mother, okay, your baby is dying, for example. Your baby has this disease. Nak bagi tahu, okay, breastfeeding kena tak cukup, kena tambah lagi breastfeeding, for example. You nak bagi tahu ni. So you must have a clear objective. What do you want to achieve from that session? You must have, the session must include appropriate personnel. Who do you need to be with you? Okay, ke just you and the mother? Ke you need one extra person? Most of the time kita nak ada seorang nurse as witness, for example, at least as chaperone. Or do you need the father to be together? Or you need someone else? You need a grandfather together with them? Or you need surgeon to join you? Or you need occupational therapist, physiotherapist, dietitian, nutritionist? Who do you need to be there with you? Do you need dentist to come and stay with you? Or do you need a translator, for example? Do you need someone who can speak with the language? So appropriate personnel must be there, and ideally it should be scheduled. It should be a planned time. Sebab apa? Sebab bila it's not planned, sometimes tengah-tengah you tengah discuss, tengah cakap, ada orang interrupt, your phone ringing and so on and so forth. And it needs preparation, adequate information. You need to prepare some pamphlets, for example. You nak bagi tahu pada parents, you punya anak ni ada GHPD deficiency. Probably you nak kena ada pamphlet yang bagi tahu this is GHPD deficient, apa benda yang dia tak boleh ambil, bla 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 bla. So information. Apa information yang perlu? Adequate personnel. Sometimes you may even ask the parents, okay, kita nak jumpa masa ni, what are your questions? So questions tu can sometimes be given earlier. Okay, kita nak jumpa hari Friday. Is okay, you give any questions or any concern, you can give to us verbally or by written, probably on Wednesday or Thursday. So that masa jumpa on a Friday tu, we are ready with all the answers to your concerns and questions. So it needs to have preparation. Okay, and then setting. How do you set up the setting of that interview, of that session? So it must have privacy. Privacy as per needed. Sometimes you need proper privacy. Sambil you nak cakap, you nak bagi tahu HIV positive, for example. You nak bagi tahu patient is dying, for example. You tak boleh lah bagi tahu anak dia is dying depan orang ramai, semua orang tengok, semua orang dengar, ada orang record video dan sebagainya. No, you need to have privacy for them to cry. Kan? Kena ada tempat dia boleh ada tisu, for example, kan? Ada tempat dia boleh cover. So adequate privacy as per needed for that particular session. It must be comfortable. You tak boleh nak cerita benda heavy, benda sedih dalam keadaan you tak ada chair. Kalau chair pun sometimes, kalau you nak bagi tahu the mother, baby is dying, for example, or baby has died. You need chair, at least dia boleh duduk, kan? And then not just that, chair tu ideally bukan chair yang ada tayar. Sebab apa? Kalau dia diri, kalau ada tayar, dia duduk, jatuh kadang-kadang. So ideally, in that setting, you need chair yang tak ada tayar, yang fix. Bukan fix lah, maknanya you boleh gerak, tapi maknanya yang tak ada tayar. Kan, so bila dia duduk, atau dia ni kan, dia tak bergerak. For example. So, you need, sometimes kalau chair tu pula bunyi squeaky sangat, duduk sikit bunyi squeak bunyi kan. So, pun tak comfortable. Macam mana you nak communicate kalau you gerak sikit bunyi squeak, bising kan. So, it must be comfortable. Right? Dia tak ada banyak noise, no disturbance. The room must suit the purpose. Kan? Suit the purpose macam contohnya, if you need contohnya appropriate room, appropriate equipment. Contohnya you nak ajar parents macam mana cara nak buat resuscitation. Dan baby ni ada cleft atau ada neurological problem, Down syndrome, Edward syndrome, extreme premature baby. You nak dischargekan home. You nak kena ajar parents how to do CPR, how to do BLS, basic life support. So you need to teach them. So you need to do the session in a room with adequate equipment. Ada mannequin, you boleh ajar macam mana nak buat, kalau baby choking nak buat macam mana. So what are equipment that you need? You nak ajar breastfeeding for example. Ideally ada equipment dia, ada apa breast tipu yang you boleh ajar dummy breast kan. You boleh ajar macam mana nak bagi breastfeeding dan sebagainya. So appropriate room, appropriate equipment, the room must suit the purpose. And ideally juga bila you communicate with parents, for example, kan, so if you look at most clinic sekarang ni, dia tak buat dah depan-depan, opposite, duduk opposite, kan. Kadang-kadang dulu setup kita, patient duduk kat opposite kita, ada meja pula tengah-tengah. Sekarang ni no, sekarang ni kita letak patient kat tepi. Sebab apa? In certain setting lagi dia buat 90 degree ya. Maksudnya patient doktor duduk kat sini, patient duduk 90 degree kita. So apa? Sebab bila you go opposite to the patient, sometimes subconsciously it reflects the situation that you are opposite them, you are against them. But if you are together with them, they can agree with you better subconsciously. Kan? Sebab you are with them, you are not against them. So these are human nature. And remember, no disturbance. Tak ada orang kerja call, ni doktor nak ni nak tu ni. So no disturbance. So introduction. So whenever you start the session, make sure introduction must be proper. This is one aspect yang UI students usually tak buat proper. Geram betul saya. Kan? You need to introduce yourself, need to introduce all the attendees. I am doctor so forth, I am medical student so forth, this is my lecturer, this is introduce everyone. Kalau 30 orang tak payah introduce 30 orang. Kan? Maksudnya introduce ni siapa dan what is their role. Nah, kenapa dia tu kena ada. Kan? You kena tell them there should not be any semua orang kena ada purpose in that session. Tak boleh ada penumpang. Kena ada orang yang setiap orang tu kena ada purpose dia. What is their role in that session? Kan? You need to tell them. Kadang-kadang ada orang tu kerja dia cuma tukang catat dia. Kan? So kita tahu lah this nurse her role for today is actually to write down our document, our discussion. So kena ada ni. Kan? And then obtain consent. Bukan you bertulis. At least you bagi tahu okay, hari ni our purpose of this session. So ni siapa, I'm siapa, this is our role. Hari ni kita nak discuss pasal apa. Okay, can we discuss this? Can we proceed? Can we obtain consent to start the session? Obtain consent to do the examination. Obtain consent to take history. Saya ni saya nak tanya soalan untuk exam ni. Boleh So get consent for everything that they do. So get consent. It should be part of your and then ascertain the objective. Objective tu nak kena bagi clear. You must ascertain what is the objective of the session, and all attendees must know the purpose of the session. You kena tahu apa purpose session tu, patient tu, parent tu kena tahu what is the purpose of the session. All the attendees must know the purpose of the session. Tak bolehlah you doktor medical side you nak achieve benda ni, tapi dietitian ingat benda lain, surgeon ingat benda lain, ni ingat benda lain. So masing-masing ada banyak objektif masing-masing sendiri. No one will reach the objektif. Semua orang takkan capai apa-apa yang semua nak. So you need everyone in the attendance must know the purpose of the session and must share the same goal. Okay? And then know the background of the parents, know background of all the attendees. Yang datang tu, yang mak dia, father dia, apa background dia. Kalau parents tu kerja as doctors for example, dia tak bolehlah cakap in layman. You kenalah use medical jargon. Kan, kalau parents dia kerja lawyer for example, you kena kurangkan medical jargon, tapi you need to be more detailed and more precise. Kan, if parents are teacher, macam-macam. If parents are odd job worker for example, tapi odd job sekarang engineer pun ada odd job worker. So sometimes kerja dia tu doesn't determine actually their education level. Kalau dia jual insurance for example, maybe they are doctors. I have doctor friends actually quit becoming doctor and jual insurance and earning more daripada specialist pun. Kan? Well, I have doctor friend who sekarang jadi toke jual kedai apa? Kedai handphone. Kat Kelantan, apa nama kedai tu? Banyak pula cawangan dia, maju, lagi kaya daripada specialist pun, tak ada halnya. I have doctor friend, very good doctor, graduate from UK, now owner of multiple computer punya shop. Rumah ada bapak besar dekat Kelantan tu, kan? Apa banyak cawangan kedai komputer dia, earning lots more daripada dia. So sometimes what I'm trying to say is, kerja dia does not necessarily mean does not necessarily reflect their level of education, kan? But you need to know lah, kan? Kalau you nak cakap about anak dia ada sakit apa, parents dia pediatrician for example, there should be some level of decorum, some level of you need to know. Bila tahu level background of the attendees tu, baru you tahu how deep you want to go, how superficial you need to go, kan? So background of the attendees. And then tahu juga siapa lagi yang datang. Sometimes ada community punya people, community punya nurse, community midwife yang datang sama dalam session. Ada occupational therapist yang datang. So you need to know a bit of their background, kan? Anti-vaxxer for example. Sekali ada parent ada yang ikut datang anti-vaxxer, kan? You need to speak with them in a different note, kan? Obviously you need to speak with them. Cuma how you approach them is going to be a bit different. Kan? I've had a patient before, baby dia born with tracheoesophageal fistula with esophageal atresia. Baby definitely esophageal atresia. Baby nak feeding macam mana? Kan? Kena buat operation. Masalahnya, father budak tu was a bomoh kampung who don't believe in modern medicine. Dia kalau boleh nak beranak kat rumah pun. Cuma sebab ada problem, ada complication, terpaksa deliver in one of the hospital somewhere in East Coast Malaysia, kan? Lepas tu baby keluar pula ada pula problem esophageal atresia, kena buat surgery. Father dia don't even believe in modern medicine. Kena minum air tawar. Baby nak minum air tawar macam mana? Esophagus pun tak ada, kan? So nak kena buat operation. How you approach them will be different, kan? So you need to know the background of the parents and all the attendees. Language, kan? You dah cerita berbuih macam-macam, sampai berbuih apa semua keluar cerita, sekali dia tak faham apa sebab dia doesn't understand Malay, for example, kan? So you need to know what language do they speak. Sometimes they say they can understand a bit, but sometimes it's not good enough for them to understand deeper problem. So understand the command of language. Do you need to speak with them in English? Or do you need to takalam Arabi with them? Kan? Or do you need to speak Mandarin? Or do you need to get language line? So sometimes ada hospital dia ada language line. You boleh call satu number, you boleh speak. You cakap, you pass phone. Kan dia akan cakap balik dan sebagainya. Or you need to get translator to come and sit with you on the session. Kan? Or you need someone else, you need nurse yang boleh cakap different language. For example, I've had several sessions, kan? A patient boleh cakap Portugese, for example. I look for nurse yang boleh cakap Portugese, boleh cakap Spanish, kan? So go and speak with them at language that they can understand. Level of education I've mentioned before, work of them, and level of prior understanding, kan? Kalau sebelum you had that session, ada dah doktor lain dan dah mention pasal that particular problem, kan? You tak payahlah start balik daripada background, daripada asal-asal mention dulu. No, you start off where someone has apa tu ada cakap sebenarnya, you start off in the middle and you go forward, or you can go a bit deeper. So that is why you need to know the level of prior understanding. Mak, sebelumnya ada doktor lain yang cakap pasal masalah anak ni, kan? Tanya dia balik, apa yang mak faham? Assess the level of understanding, so you can proceed from there. You tak payah start balik daripada from the beginning, and assess their level of expectation. Apa dia expect? Faham tak? Sometimes bila you buat session tu, dia tahu objektif, tapi expectation dia lain, kan? So kita nak kena reach their level of expectation. Assess understanding. I've said that before. You need to assess their level of understanding. What do they actually understand from the problem? Kan? Before you start, always say, okay, mak faham tak apa kita nak buat ni? Apa yang mak faham pasal penyakit dia? Setakat ni apa siapa dah bagi tahu? Assess balik apa dia punya kefahaman. Mak tahu tak pasal treatment yang kita nak buat ni? So and then baru you go deeper. Kan, sometimes people dah Google dah. I've had patient bukan setakat dah Google about the disease, dah Google me pun. Tengok siapa specialist yang jaga, Dr. Syed, Google semua. Dr. Syed ni, itu keluar kat sini, habis. Sudah. Dekat phone ni, dia cakap pun keluar. So some people sekarang dia macam tu. Kan, even dia bukan setakat Google the disease, they Google the doctors looking after the child. Kan, so assess their level of comprehension and understanding. And use language accordingly. Do you need language line? Do you need translator? Do you need, ideally we don't want layman untuk jadi translator. You tak boleh macam you tak faham satu bahasa, kan? I have had parents sebelum ni dia cakap Rohingya, kan? You tak boleh panggil patient lain yang Rohingya untuk jadi translator sebab there's a privacy component dekat situ, kan? Dia tak boleh nak. Maknanya the other people should not know unless kalau parent tu allow, kan? So but you nurses you can, other healthcare personnel you can. So cari healthcare personnel lain yang boleh, your own staff yang boleh cakap bahasa lain, come and get them to be translator, for example. And I've mentioned before, avoid jargons. Ideally avoid medical jargons, avoid whatever jargon where appropriate. But if your client, if your patient, if the parents are actually medical personnel, for example, you need to speak in a proper decorum lah. Tak boleh lah cakap macam kampung dengan pediatrician, kan? So unless kalau the disease is actually orthopedic diseases, pediatrician bukan ngerti sangat pasal ortho punya ni. Dental, for example, kan, I don't know dental punya problem, kan? So use appropriate jargon appropriately. Appropriate jargons appropriately. So ideally you avoid, but you can use jargon where appropriate. Dalam communication session tu ada ni. Too much jargon ada, pemakai ada. Cover the concern. So before you begin, you need to ask what are the parental concerns, and you need to selesaikan semua concern dia. Ascertain what are the concerns, assess and cover, settle all their concerns. Apa isu dia? Apa mak risau pasal anak? I've had parents before, anak dia had apa nama dia, ada budak ni 11 years old, already had thyrotoxicosis, grave disease, hyperthyroidism, thyrotoxicosis, grave disease, on treatment. Lepas tu admitted in our ward because of diabetic ketoacidosis, newly diagnosed insulin dependent diabetes mellitus. Adalah dia dah banyak masalah budak tu sebab ada grave disease. Sekarang pula budak perempuan pula, lepas tu dapat DKA pula, kena start on insulin, so on so forth. One day I found mother dia menangis. Kenapa dia nangis? Adakah dia risau sebab treatment? Mak risau apa? Mak risau macam nak jadi anak dia, anak perempuan, kan? Nak kahwin susah, bla 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 bla. Dia fikir benda tu, kan? Kita fikir mungkin mak risau pasal treatment, macam mana kan anak dah ada penyakit ni, kan? Rupanya mak fikir beyond daripada apa yang kita fikir tu, kan? So sometimes sebab tu kita kena tanya apa concern dia, because sometimes our concern as medical personnel dengan parents punya concern different. COVID is a problem. COVID stigma. If you see my Facebook, I think today I've shared one of my friends. They share about COVID stigma. Kan? We've had one family died masa tu. I don't remember, was it COVID ke tak masa tu still pending COVID punya result. Death. I'm not going to say which hospital lah. So patient tu dah died, dia memang dah old age, ada multiple underlying disease, multiple comorbidities. So you know, bila kita ask the family, bila kita counsel the family, the issue is sometimes what happens is this, with COVID stigma, the concern is not actually because of the death. The concern is what's going to happen to the family now. Because if the patient died because of COVID, the whole family will be labeled as problem. The whole family will be stigmatized. People tak boleh ni, semua orang cakap, oh ni family COVID, bla bla, semua orang kena pulau dia. Orang nak hantar makanan pun tak nak hantar kat dia. The whole family kena pulau. Walaupun yang tak ada kontak dan sebagainya. Because of stigma. Kan? So this is one thing yang kita kena concern lah. Dan kita kena concern. So sometimes it's not just the disease. It's the social stigma that comes with it. This is a problem lah. Kan? Because orang dapat COVID, it's not because they want to get COVID. Kan? If you get, you get lah. Kan? So kita kena give due respect. And then reassess understanding. So you don't just assess understanding sebelum you start. At every stage, at every level of that communication, you need to assess. Kalau cerita sikit, okay, mak faham ke? Boleh ulang balik apa yang saya cakap tadi? Boleh summarize sikit apa yang saya cakap tadi. Setakat ni faham kan? Okay, apa yang saya cakap tadi? You reassess their understanding at every level. Reassess comprehension, and not just that, before you end, always formulate conclusion. Okay, mak, kita dah cakap setengah jam dah ni, dah sejam dah kita cakap pasal masalah nak ni. Apa yang mak faham? Boleh kita rumuskan, kita tanya balik, dan kita okay, kita dah cakap sejam dah. Okay, mari jom kita okay, so secara kesimpulan dia, anak ni yang first tadi saya cakap tadi kan, anak ni kita dah tahu dia ada diabetes. Diabetes sebab ni. So anak ni dia perlu treatment ni. So lepas ni kita kena buat ni. Lepas ni mak kena buat ni. Benda ni kena jaga ni dan sebagainya. So you formulate conclusion together with the mother. Okay, mak setuju Boleh buat macam ni Okay, suruh mak buat. You tulis, suruh mak sign lagi, for example. Baru orang ingat. Kalau you setakat cerita, okay, faham, okay, settle balik. Habis kan? So but if you cerita, and then you assess comprehension and you formulate conclusion together with the mother, baru dia akan betul-betul faham dan betul-betul clear. Kan? Lepas tu baru dia tak kalau dia tak compliant tu baru senang nak belasah sikit kan. So other important points. First, empathy. Empathy ni masalah orang kita ramai tak ada empathy. Muka keras kan? Muka keras-kerasnya. So how we need to show empathy? So empathy tu maknanya you need to have the same, so you can be emotional together with the patient. You should not be emotional towards the patient. You can be emotional together with the patient. I have cried. I've had my patient. I remember one of the case yang I betul-betul menangis betul kan, adalah one of my patient. I look after that baby from 2 months old. The child had infantile leukemia. The child died on me. I discharged the child, dia died on the way home. Masa dia umur 14 bulan, setahun 2 bulan. The child learn to walk in my ward. So memang bila nak discharge tu comel benda tu. Bila nak discharge tu memang I really cried. Kan? So we can be emotional together with the patient, but we cannot be emotionally attached to the patient until it affect our professionalism. Kan? Tapi we can be emotional with them. We need to show appropriate emotion. Bila you nak cerita benda sedih, anak is dying for example, muka pun kena muka appropriate lah, kena muka sedih lah. Tak boleh nak cerita anak nak mati tapi muka dia sengih-sengih macam tu kan. Tak boleh lah, sikit-sikit gelak-gelak sikit. Tak boleh kan. Tak boleh nak cerita anak dah sihat, kanser dah cure tapi muka sedih. Nada pun sedih. Macam maaf mak. Anak ni kanser dia dah baik dah alhamdulillah, tapi muka sedih. Tak boleh. Kan? So appropriate emotion. Benda sedih kena sedih, benda gembira kena gembira. Situation pun sama. You tak boleh. I've had situation before. Kita nak counsel anak dia dah mati. anak dia dying, kat belakang-belakang tu nurses MO gelak-gelak ketawa kat belakang. Tak boleh lah. Kan? Not just you, your surrounding must have the same empathy towards the patient. Everyone struggles. Everyone struggles. Understand the feelings of them. So kita kena acknowledge. And then open-ended question. So ideally we use open-ended question. Close-ended you can use but use appropriately. Close-ended ni you tanya yes, no for example kan. Specific question. Ideally you need to use open-ended. Rasa macam mana kan? Apa rasa? Sakit macam mana? Cuba ceritakan kan. So those are open-ended kan. Tapi sometimes you do need to go a bit specific. Sakit tu kat mana? Sakit tu macam mana? Macam ni ke? Macam ni ke? Macam ni ke? Macam ni? Mencucuk ke? Panas ke? Macam menekan ke? So sometimes you do need to give a bit close-ended, but not all the time lah. It's open is preferable, but may need some close directed questioning if needed. Do not feed words into mouth. Maknanya jangan you pula bagi tahu sakit tu macam ni kat sini macam ni kan? Ya kan? Sometimes people akan cakap ya. Sebab apa? Sebab you are the one that feeds the answer. You nak jawab macam tu. Sakit dekat right leg fossa kan? Sakit sini. Saya tekan sakit. Okay? Sakit. Of course lah. You don't give option kan? People akan jawab cara question pula macam tu kan. People akan jawab ya. Kan? So do not feed words into their mouth. Jangan pula dia yang main dia kan, jangan dia tak faham apa yang you cakap. So you cannot be a good speaker unless you become a good listener first. Only a good listener may be a good speaker. Sebab itu ramai orang sakit-sakit apa semua, the moment jumpa doktor baik, demam baik, semua baik, ubat tak kasih lagi. Jumpa je sebab at least they have someone yang dia boleh cerita masalah dia. Walaupun masalah dia just demam, sakit tekak, batuk kan. Because human being, the moment we can release what is our problem, kan, kita akan be releasing is cure. Releasing is part of treatment. Kan? So you need to become a good listener. Dengar cerita, dengar betul-betul. Sebab sometimes parents, I have patient complain kata doktor ni kan cakap tak dengar, cakap tak faham kan. So ramai orang that's the problem. So you need to become a good listener, good listener. And then non-verbal. So when you relay any information, actually 80% goes with non-verbal. Non-verbal ni macam mana? Non-verbal intonation. If you hear my speech has different intonation. Kan? Certain important topics I go a bit higher pitch, higher tone. Kan? Less important we go a bit slow. Kan? So important points you go slower. Pace you slow pace. Less important you go a bit faster pace. Kan? So intonation actually affects the mood, affects the empathy, affects the importance of the message. So intonation is very important. Facial expression, and how you express your face. Your face actually reflects honesty. For example, how honest you are with what you are trying to say. Kan? It must be the empathy, the emotion must reflect same with whatever you are saying and with the expression on your face, your body language, your hands. Macam mana tangan you letak macam mana? Ke tangan you cakap dengan parent tangan macam ni. This is defensive punya pose. Or you letak open body punya pose. Tangan kat, I cannot show lah with this one. This should we can have a proper session about body language. Kalau boleh remind me kalau boleh kita boleh buat the whole group, your group year 5 kan, effective communication. I can teach you about how to show proper non-verbal cues, for example, how open body language, tangan macam mana, how you put your hands actually may show that you have wisdom, for example. Benda yang orang tak perasan tapi it goes into the subconscious mind. How to answer questions, for example. Certain orang orang tanya je tu jawab, tanya tu jawab. Tapi sometimes even if you know answer, if you pause, orang tanya soalan, you pause or you jawab. Sometimes it actually reflects wisdom. Kan? For example lah, body language, position of your body. If you against, it shows that you are against them. If you are at the side 90 degree, if you're by the side, contohnya you nak cakap kan, you letak parents kat sebelah you. Macam tu kan you cakap sebelah tu. It shows that you are with them. Subconsciously it affects better. Kan? So how the position of your body, ya? You berdiri, duduk dan sebagainya, ambience of the room. Kan? Kalau benda sedih, ambience dia must be a bit sedih lah. Gembira, ambience of the session pun must be a bit masuk dia. And then touching, you cakap, you touch, sentuh bahu dan sebagainya. So all these are how you can actually reflect and emphasize on certain topics. Nanti bila buat face to face, I'll show you the power of actually touching ni. Jangan touch semua orang, jangan touch appropriate touching. And then mirroring, mirroring ni you mirror the tone of the speech. Dia cakap dengan higher pitch, you increasekan pitch of the voice. Dia duduk, you duduk. Dia letak tangan dekat meja sebelah tangan, you letak tangan sebelah meja. Dia sandar badan dekat dinding, you sandar badan dekat. Dia sandar macam ni, you sandar macam ni. Those are mirroring techniques actually can help you in terms of communication. Janganlah copy macam apa nama tu? Yang buat clown tu kan. Bukan macam tu, tapi maknanya you mirror. Dia ada teknik, mirroring teknik ni, so that you can break the subconscious barrier tu. And it can help you understand and so on so forth. Okay, kalau you look at communication punya papers, banyak orang akan cakap pasal spikes. Spikes ni is a well documented, well researched punya teknik lah. So spikes ni apa? S is setting up the interview. The session, communication session or any session, it needs to be set up. I've mentioned before, setting up the interview ni macam mana? You should mentally rehearse, plan. I've mentioned before, plan the session. Mentally rehearse. Arrange for privacy. Sit down. Use open body language. P for perception. Elicit the patient perspective. Ask apa dia punya concern, apa perspektif dia. Assess understanding. Assess what's the belief and feels. How religious they are. Macam mana dia rasa dan sebagainya. Assess vocabs and comprehension. Assess the level of vocabs that you need to use and level that they are understanding. Kan? I for invitation. Invite the patient. Invite the patient to ask. Kan? Ask the patient what they want to know. Kan? Obtain permission to share knowledge. Boleh tak saya kongsi benda? Boleh tak saya cerita pasal benda ni? Ask them. Because when they are the one that wants the knowledge, it gets to their subconscious mind. Kan? An empty cup is easier to fill rather than a full cup. Kan? So bila dia yang minta the knowledge, it's easier for you to give the knowledge. Okay, knowledge. Provide info in small bits and pieces. Sometimes satu session, just part of the information you can discuss. Arrange for another session for you to discuss a bit more. Because sometimes it's very difficult for people kalau you bagi banyak sangat information at one time. So provide info in small pieces and use simple language. E for emotion, appropriate emotion. Explore the emotion and explicitly recognize and empathize. You kena betul-betul tunjukkan, I understand how you feel. Show that you actually recognize the emotion that the parent, the patient is actually feeling. So explicitly recognize that you acknowledge their emotion and strategize and summarize. So set out medical plan of action, discuss sama, okay, ini kita punya plan of action dan so on. Arrange follow up, offer. Okay, boleh tak kita arrange follow up? Perlu tak saya refer pada orang lain? Perlu tak saya ni arrange for follow up? Call for help. Call for help ni maknanya apa? Offer to discuss with senior. Okay, saya dah discuss panjang lebar ni. Mak rasa perlu ke, nak ke saya panggil doktor pakar senior untuk datang jumpa? Perlu tak saya rujuk pada pengarah hospital ke? Perlu ke saya rujuk pada doktor pakar ke hospital lain ke nak jumpa? Perlu tak saya rujuk pada bahagian jabatan lain, for example? Perlu tak saya rujuk mak nak jumpa dengan bahagian psikiatri ke? Kan? Nak dapat psikologi, nak dapat pertolongan macam mana? Nak saya rujuk kepada bahagian kebajikan masyarakat ke? Social worker, siapa-siapa, offer to be referred. Offer for follow up. Boleh tak, okay, kita jumpa lagi sekali dalam seminggu lagi ke, minggu depan ke, kita jumpa sekali lagi. Arrange for follow up. Other aids. So other aids, apa yang ada lagi? Visual aids. For example, you nak visual aids, charts and drawing. For example, you nak counsel mother, baby dia ada patent ductus arteriosus in failure. So probably it's good kalau you can draw ni right atrium, ini right ventricle, ini mana. So PDA ni is a shunt between the pulmonary artery to the aorta. PA to AO, which is normal masa in utero. Bila lepas baby keluar, baby nangis, biasanya ditutup macam ni. Sekarang ni dia still open. So what's going to happen? So you draw. Bila you draw, they can understand better. Janganlah semua benda you nak draw. Kalau anak GCPD deficient, you nak pergi draw bilirubin pathway, for example. Peninglah dia. Kalau exam nanti bolehlah, kan? Manalah tahu kalau keluar exam, draw bilirubin metabolism, kan? Manalah tahu, kan? And so, tapi so appropriate drawings, appropriate chart, for example, kan? Even sometimes when I meet mothers in labor with extreme premature babies, for example, it's good kalau kita ada gambar-gambar, okay? Ini gambar premature baby, extreme premature babies yang dah survive jadi macam ni, kan? Ini incubator, ini ventilator, so they can see better. Okay, so the other aids that we can use for communication. Okay, that's it. 1 hour. Exactly 1 hour. Any question? Clear? So, boleh kalau dapat communication station. You guys, I don't know how your exam is going to be lah. I seriously don't know. Our exam change, our exam method change every few weeks. Is going to change depending on COVID. Hari ini berapa? Almost 1,300 total cases in Malaysia. Selangor aja ada 200 case plus. Puahlah. So I don't know. I seriously don't know what's gonna happen. You pula sebelum your exam ada break sekejap kan? You pergi face to face kat department lain. I don't know. Whether you're going to have exam dekat HTA nanti ke, or you're going to have exam as modified long case where we call patient ke, I don't know. But if it's going to be like modified long case, it's going to be almost like a communication setting. So read back whatever I've shared. Kita punya slot yang ni dia tak boleh record pula. I don't know if some of you record. Kalau tak, if not, we have our pediatric department YouTube. Boleh cari. We have several already. The same topic, same slide, almost the same lecture pun. Tapi kali ni lebih sikit kot. So you can view back. So because I think this communication is actually important, it will be useful for you later on. And obviously when you do masters nanti, we will grill you more because masa buat masters memang definitely communication is very important. If you do membership exam, so membership exam ni is UK based. So obviously for UK and these Western countries, communication is extremely important. Memang ada communication station. So if you want to do membership exam, MRCPCH, MRCP, MRCOG, MRCS, and so on and so forth, obviously communication is very important as well. And these are the things that you need actually for the communication station. Okay, all right. Any question? Let's wrap up. I need to see at the patients. Okay, fahimtum kalami. Okay, I think if there's no further question, let's end our session with tasbih kafarah salatul asr. Okay, assalamualaikum warahmatullahi.
Waalaikumsalam.
Thank you, Doctor.
Okay, assalamualaikum.